Most people miss these vitamin D symptoms. These symptoms are often overlooked, misdiagnosed, or silently ignored, while your health keeps getting worse. You might think it's too late to fix, but the good news is most of them are fully reversible once you correct the root cause soon enough. Let's uncover them before they become harder to treat. Symptom number one: constant fatigue that doesn't go away. You sleep okay. You eat fairly well. Maybe you even squeeze in a little exercise. But despite all that, you're still tired every single day. Now, I'm not talking about the kind of tiredness where you stayed up too late watching something on your phone. This is deeper. It's a kind of exhaustion that sleep won't fix, and caffeine can't even touch. Here's what most people don't realize: that kind of chronic fatigue, the kind that lingers no matter what, is one of the most overlooked signs of a vitamin D deficiency. Let me explain why. Vitamin D plays a critical role in how your body makes energy, right down at the cellular level. Inside your mitochondria, think of those as tiny power plants inside each of your cells. Vitamin D helps regulate how much energy they produce. Now, if you're low on vitamin D, your mitochondria can't work efficiently, which means your brain, your muscles, even your heart, they're all running on low power mode. One large study, published in the North American Journal of Medical Sciences, found that over 77% of people dealing with chronic fatigue were also deficient in vitamin D. Once their levels came back up, their fatigue significantly improved. And get this, another randomized controlled trial showed that vitamin D supplements improved muscle mitochondrial function, which basically means better stamina and less exhaustion day to day. But it's not just about muscles. Vitamin D also affects how much ATP you produce. That's the energy fuel every organ depends on, your brain included. So when vitamin D runs low, ATP production slows down. That's where mental fatigue kicks in. Simple tasks feel draining, and clear thinking out the window. So if coffee doesn't help, if even a nap won't cut it, maybe it's not just that you're tired. Maybe your cells are starving for sunlight, and that could mean you're deficient. Symptom two: getting sick all the time. If you seem to catch every cold, flu, or little bug that's going around, and it takes forever to bounce back, this probably isn't just bad luck. Your immune system might be starved of a critical nutrient, and that nutrient is vitamin D. Now, vitamin D doesn't just boost your immune system, it actually helps regulate it. Think of it like the conductor of an orchestra. Without it, your immune cells are out of sync. They either underreact, letting infections slip past, or they overreact, causing unnecessary inflammation. Here's how it works. Vitamin D enhances the function of your macrophages and monocytes. These are your immune system's first responders. It also helps your body produce natural antimicrobials, things like cathelicidin and defensins, which literally punch holes in bacteria and viruses, helping your body neutralize infections before they take hold. And get this, a large meta-analysis found that people deficient in vitamin D were significantly more likely to suffer from upper respiratory tract infections, things like colds, bronchitis, and the flu. Now, here's the kicker. When they started supplementing with vitamin D, especially daily or weekly, the risk of getting sick dropped dramatically, especially for those with already low levels. Another clinical review found that children with low vitamin D were more prone to ear infections and recurrent sore throats, which shows how this deficiency can affect all age groups. But it doesn't stop there. Vitamin D also supports your adaptive immune system. That's the part responsible for remembering past infections and making antibodies. Now, without enough vitamin D, that system can go haywire, increasing your risk for autoimmune conditions like multiple sclerosis, lupus, or type 1 diabetes. So, if you're getting sick more often, if your colds seem to hang on longer than they should, or if your body just doesn't fight like it used to, don't brush it off. That might be your immune system. waving a white flag, and vitamin D could be exactly what it's missing. Symptom 3, muscle weakness, aches, or heavy limbs. Your body feels stiff, your arms heavy, and walking upstairs suddenly feels like climbing a mountain. Now, that's not just aging. And no, it's not just because you're out of shape. This could be something deeper, a kind of cellular level weakness. And vitamin D might be right at the center of it. Vitamin D is critical for muscle health. It influences how your body takes up calcium, how it builds protein, and how your muscle cells repair themselves. In fact, vitamin D receptors are built right into your skeletal muscle fibers. And when your levels drop too low, those muscle fibers shrink, lose strength, and start reacting slower. So your muscles don't just get weaker, they also become less responsive. They recover slower, and they're more prone to injury. Now, here's what the science says. A comprehensive meta-analysis found that vitamin D supplementation significantly improved proximal muscle strength, especially in the hips and thighs. That matters because those are the muscles you rely on to stand up, walk around, or climb stairs. Another randomized trial confirmed it. Even modest doses of vitamin D improved grip strength and knee extension in adults, especially older adults. And it's not just about strength, it's also about pain. Low vitamin D is often linked to something called myalgia, which just means nonspecific muscle pain. No injury, no trauma, just persistent soreness or aching. Here's why that happens. Vitamin D helps maintain calcium homeostasis inside your muscle cells. And when calcium gets thrown off balance, your muscles can cramp, spasm, or feel sore, even without a clear reason. Sometimes that pain gets misdiagnosed as fibromyalgia. Other times, it's just blamed on inactivity. But what's really happening? Your muscle fibers aren't getting the nutrients they need to fire properly or repair efficiently. And get this, recent studies now show that vitamin D may also influence muscle mitochondrial function, which directly affects endurance and how quickly you recover after exercise. So if your vitamin D is low, your muscles won't just tire faster, they'll stay sore longer too. The problem? Clinicians often miss this. They see your pain and say, just move more. But when your recovery lags and your soreness lasts for days or even weeks, the issue may not be structural. It might be biochemical. So if you've noticed a drop in strength, if you're getting winded more easily or feeling weak faster than usual, it may not be your age. It may not even be your lifestyle. It could be your vitamin D levels holding you back. Symptom number 4, feeling down, depressed, or emotionally flat. This goes beyond sadness. It's that strange emotional heaviness. You feel emotionally numb, maybe irritable, or just not quite you. Many people dealing with vitamin D deficiency say they feel down or disconnected with no obvious reason. And here's why that happens. Vitamin D plays a powerful role in your brain chemistry. Your brain is loaded with vitamin D receptors, especially in areas that regulate mood, emotion, and cognition, like your hippocampus and prefrontal cortex. Now, when your vitamin D drops too low, those brain areas don't function efficiently. And that messes with how your body produces and uses key neurotransmitters like serotonin, dopamine, and norepinephrine, the very chemicals that keep your mood stable. A large-scale meta-analysis found that people with low vitamin D levels had significantly higher rates of depression. And those who received supplementation, they saw noticeable improvement, especially if they were already deficient. But it's not just clinical depression. Low vitamin D has also been linked to seasonal affective disorder. You know, that foggy, unmotivated feeling that hits in winter? When sunlight and your vitamin D plummet. That's not just psychological, it's often biochemical. Emerging studies now show vitamin D may help reduce inflammation in the brain. And chronic neuroinflammation has been tied to both depression and anxiety. So when there's not enough vitamin D to calm that internal fire, emotions get unstable and motivation crashes. Some describe it as feeling emotionally flat, not sad, not anxious, just blank, like your spark is gone. So if your mood's off, your energy's dropped, and you've lost interest in things you used to enjoy, ask yourself this: is it emotional or is it nutritional? Because sometimes the shift you're looking for doesn't start with therapy or medication. It starts with restoring what your brain chemistry actually needs. Symptom number 5: unexplained bone pain or achy joints. You wake up stiff. Your hips ache when you sit too long. Your ribs hurt, your back throbs, and the scans show nothing. But this isn't just regular soreness, it's a deep, aching pain, the kind that feels like it's coming from inside the bone. And this is actually one of the classic signs of vitamin D deficiency. Here's why. When your body doesn't have enough vitamin D, it can't absorb calcium efficiently from food. That creates a cascade. Calcium in your blood drops, so your body pulls it from your bones to compensate. And that weakens your entire skeletal system. This can lead to a condition called osteomalacia, which literally means soft bones. Unlike osteoporosis, which is usually silent, osteomalacia can actually hurt. Many describe it as a deep, nagging ache in the lower back, hips, pelvis, thighs, or ribs. A clinical study found that many adults with chronic, unexplained muscle and joint pain were severely deficient in vitamin D. And once their levels were corrected, pain and mobility improved noticeably. Now, vitamin D doesn't just help with bone mineralization, it also helps regulate inflammatory cytokines, which are involved in joint pain and stiffness. So, low vitamin D doesn't just weaken bones, it can also amplify joint discomfort, even if your joints look normal on imaging. In fact, vitamin D deficiency is linked to worsening symptoms in osteoarthritis and rheumatoid arthritis. Researchers believe that low D levels can heighten pain perception, increase stiffness, and slow down your body's ability to recover from inflammation or overuse. And this doesn't just affect older adults. Even young adults can feel this, especially if they stand all day, lift weights, or sit for hours at a desk. So if you've ever asked yourself, why am I hurting so much when nothing's really wrong? It could be your bones and joints asking for help. And if your tests come back normal, but you still feel sore, stiff, and achy, don't brush it off. Your bones might be silently starving for vitamin D. Symptom number 6: cuts and scrapes that take too long to heal. You nick yourself shaving, and it takes a week to scab. A tiny paper cut lingers for days. That scrape on your knee still looks fresh after a week or two. When healing slows down, most people think of blood sugar issues, infections, or age. But often there's a silent factor at play: vitamin D deficiency. Vitamin D is more than just a bone builder. It plays a direct role in skin regeneration and tissue remodeling. It helps regulate your body's inflammatory response and promotes the activity of keratinocytes, the skin cells responsible for sealing wounds and rebuilding the skin barrier. When your body is injured, vitamin D helps coordinate the healing process, starting with controlling inflammation, clearing out damaged tissue, and stimulating the formation of new skin cells and blood vessels. Studies have found that people with low vitamin D levels tend to have delayed wound healing. In fact, one study on surgical patients revealed that those deficient in vitamin D had a much higher rate of post-op wound complications compared to those with adequate levels. Vitamin D also enhances the production of antimicrobial peptides, which help protect wounds from infection. Without enough of these natural defenses, even small cuts or scrapes may become inflamed, irritated, or take longer to close up. And it's not just your skin that heals slower. Vitamin D deficiency can also delay the repair of deeper tissues, including muscles and connective tissue, which is why some people experience prolonged soreness or lingering bruises after minor injuries. If you're healthy overall, but find that your body takes too long to repair minor wounds, or those little cuts just don't seem to go away, your skin might be missing one of the most essential tools in its repair kit: vitamin D. Thanks for watching. Take care of your health, and I'll see you in the next video.